I'm Katie, and this week I went to A400 in Holston Valley. On my first day, I learned how to administer medicines through a feeding tube, and I also went to a woman's room that had to have a baby at 24 weeks because she had bacteria in her from a turtle. On day 2, I followed another RN, and I went into a patient's room that was in isolation because they had bacteria in their stool. I also went into the little nurse's station area and watched her chart some things, and also watched her measure heart rhythms and rates and stuff on the computer and print off the pattern of the heart rhythm for the doctor. On my third day, I went into a patient's room that had leukemia and watched them draw blood. I also went to another man's room that had been addicted to IV drugs and had came off of it, but then he came back on it when his father passed away, and they had to lance his upper lip because it was super swollen. Then on my fourth day, it was probably the most crazy day because I worked with a PCT, and we kept having to go into this one man's room, and he had kidney failure, and he had broke his back, and he had really low oxygen, and he claimed that a man had told him that he was going to cut his effing head off when he came out of the bathroom. And then we went in there and we were rearranging his room to make him feel more comfortable, and we got the second bed out of there so he would know it was just his room and no one else's. And then he claimed that we were all part of a conspiracy, but I have no idea why. But then they put him back on his oxygen, and he kind of mellowed out. He also tried to call the police, but that didn't really work for him, and that's pretty much how my week went.